In this video, you're going to learn about possible signs and symptoms of anal cancer. This is a rare type of cancer that affects the anus. I'm also going to provide you with an overview of when you should see your doctor, what you should expect at the visit to the doctor, risk factors for anal cancer, as well as 3 ways to try reduce your risk, and finally, my top 3 resources for extra information as well as support. Now, just so that we've got our anatomical bearings, the anus is where your bowel connects to the outside of your body, which you'll know as the bottom. Anal cancer can start in any part of the anus, and how serious anal cancer is going to depend on lots of different factors, things like where it starts as well as how big it is, if it's spread, as well as your general health. So now we have a better understanding of the anatomical location of this, let's talk about the possible symptoms of anal cancer. Now, before we cover these symptoms, I really want to make it clear that many of them are non-specific. This means that just because you've got these symptoms, it does not necessarily mean you have anal cancer. That's because many of these symptoms are seen in other conditions and less serious problems, things like piles, which medically are called haemorrhoids, as well as anal fissure. This is where there is a break in the anal mucosa, which can be very painful when you go to open your bowels. Now, for a full video on anal fissures, please do check out the other video on this channel. So now we've covered this really important point that just because you've got these symptoms does not necessarily mean you have anal cancer. Well, let's take a look at the 6 signs and symptoms. So number 1 is bleeding from the bottom. Now, as I've already mentioned, many people do develop bleeding from the bottom for many reasons. Now, these are things like piles or hemorrhoids, which are the little veins that pouch out, especially if you're very constipated. But if you notice bleeding from the bottom, it is usually best to speak to your health provider about it. Pharmacists can often help with things like piles, but if it's more serious, or if the bleeding has been going on for some time, then it's always best to speak to your doctor. The second possible sign and symptom is itching or pain around the anus. Thirdly, small lumps around or inside the bottom. Fourthly, a discharge of mucus from the bottom that doesn't seem to be going away. Fifthly, having problems controlling when you poo, so bowel incontinence, or needing to poo often with looser, runnier poos, or feeling that despite going for a poo, it hasn't all come out and your bottom still feels full. In some cases, anal cancer may have no symptoms at all, or they might be really hard to spot. So when do you need to go and see your doctor? Well, I'd advise you to speak to your doctor if you've noticed any of the symptoms and signs that we've just discussed, or if you've noticed changes around your bottom which are not normal for you. I want to stress again that having these symptoms does not definitely mean that you've got anal cancer, but for your own peace of mind, it's usually better to be seen by them. Even if you do have something like anal cancer, the earlier it's detected, the more treatable it is. So now let's discuss what happens when you go to see a doctor, because I know many people can be embarrassed about this, but please don't be. The doctor will likely ask you some questions about your health and your symptoms. This is going to be important to give them clues around what might be going on, and in their head they'll be forming something called a differential diagnosis. Now, this is just simply a list of conditions that could possibly fit with your symptoms. They will then most likely want to do a physical examination, which usually involves feeling your tummy and inserting a gloved finger into your bottom to feel for lumps or anything wrong. This is called a per rectum or PR examination. Now, before they examine your bottom, they should explain what this will involve. They'll get your consent or permission to go ahead with the exam, and they should offer you a chaperone, which is another person who can be present in the room if you want them to be to make you feel more comfortable. Now, you don't have to have this other person present, but if it would make you feel more comfortable, then you're within your rights to ask for this. After the doctor examines you, they may refer you to see a specialist in the hospital if they think more tests are needed. Here in the UK, you'll receive an appointment usually within 2 weeks if you've got certain symptoms or signs, but again, this doesn't necessarily mean you definitely have cancer. So who is most at risk for developing anal cancer? Well, most anal cancers are caused by an infection called HPV or human papillomavirus. And you can get HPV from any skin-to-skin contact of the genital area, vaginal, anal or oral sex, or sharing sex toys. Now, thankfully, anal cancer is rare, and most people affected by HPV will not develop cancer. Now, you're also at potentially increased risk of getting anal cancer if you have anal sex, if you're over the age of 75, you smoke, you have cervical or vaginal cancer, you have a weakened immune system, such as from HIV or an organ transplant. And so to try and reduce your risk of anal cancer, I'm going to give you 3 things that you could try do. Number 1, always try use a condom when having sex to lower your chances of getting HPV. Number 2, keep sex toys clean and don't share them. And number 3, try to quit smoking. Now, if your child is eligible for the HPV vaccine, which is usually called Gardasil, then they should have this. In the UK, this is usually given to all children aged between 12 to 13, and it helps to protect against things like cervical cancer as well as anal cancer. Now, if you've been to see your doctor and they want to refer you on to the hospital to see a specialist, well, what tests might be offered? Well, you might have some tests and scans to check for anal cancer if the GP refers you to a specialist. These tests are going to depend on your symptoms, and the tests might include putting a thin tube with a camera and a light into your bottom to check for any changes. They may also take a small sample from your anus, which is known as biopsy, so that it can be looked at in a lab under a microscope, as well as some blood tests. Finally, let's discuss some potential treatment options. And in this video, I'm not going to cover lots of treatment options because treatment for anal cancer is decided upon by lots of different specialists in the hospital, people like oncologists, these are the specialist cancer doctors, surgeons, and also yourself, the patient, who should be involved in deciding what treatment options you think may be best for you once all the options are presented to you. But when deciding on the treatment plan, the team and yourself are likely going to take into account things like the size of the cancer, whether or not it's spread, and your general fitness. But some potential options can include a combination of radiotherapy and chemotherapy, which is called chemoradiation or chemoradiotherapy. Now, just so you're aware of what this involves, radiotherapy uses high-energy radiation to kill cancer cells. Chemotherapy uses medicine to kill cancer cells. Sometimes surgery can also be used to try and cut the cancer or remove the cancer out. Now, whatever treatment option you decide on, the team looking after you are going to talk you through the various different options, as well as the benefits and side effects of the treatment options. They're going to work with you to create a treatment plan that is going to be best for you. They will also try to help you manage any side effects, including changes to your diet that might come about as a potential diagnosis. Now finally, what are my top 3 trusted and informative resources for you to take a look at if you want to find out more information? So if you're here in the UK, my first top resource is the NHS website. This contains lots of information ranging from symptoms to investigations and treatment options for anal cancer. The next is Cancer Research UK's website, which contains loads of useful information about what symptoms to look out for and when to see your GP, and I've included a link to this in the description box of the video. The third really helpful and useful resource that I can recommend is the Macmillan Cancer Charity website, which contains lots of useful information on treatment options for anal cancer. That brings us to the end of the video. I hope you found it useful and informative. I've included all the information that I used to make the video in the description box. And if you did enjoy the video, please remember to like it, subscribe to the channel if you've not done so already, and leave me a comment in the comments section. Thanks for watching, and until next time, bye.